So now students, until now we have discussed that what is happening in the smooth muscles. So in smooth muscles, we have myosin light chains, we have actin. Whenever there is activation of the myosin light chain, what will happen? The activation will be by the addition of the phosphate group by phosphorylation. That will be by the myosin light chain kinases. So whenever there is phosphorylation of this myosin light chain, it will get activated. It will make complex with the actin. As a result, there will be contraction. So now what is happening in your smooth muscles? That actually we have calcium that form complex with the calmodulin. This calmodulin is basically activates the enzyme that is myosin light chain kinase. So we have myosin light chain which is kinase enzyme which is present in our smooth muscles. So whenever there is activation of this myosin light chain kinase, its activation will result in the phosphorylation of the myosin light chain. As a result, there will be contraction. Now, what's increased level of cyclic AMP is doing in your smooth muscles? So, we have myosin light chain which has been converted into activated form, but whenever there is increase in level of the cyclic AMP, this increased level of cyclic AMP will result in deactivation of the enzyme that is myosin light chain kinase. Now, this cyclic AMP will increase level of cyclic AMP will actually cause the phosphorylation of this enzyme. This is myosin light chain kinase. So whenever there is formation for phosphorylation of the enzyme, there will be deactivation of the enzyme. So whenever there will be deactivation of the enzyme, definitely there will be no contraction. There will be no contraction in your smooth muscles. So the ultimate result of cyclic AMP is that it is increasing in contraction in your cardiac muscles. It is decreasing your contraction, that is, it is relaxing your smooth muscles by the increased level of cyclic AMP in your smooth muscles. So, students, conclusion is that in beta-1 receptors, there is cardiac contraction, there is increased blood supply. When we talk about the beta-2 receptors activation, there is bronchial relaxation, there is increased oxygen supply. So this was all about the mechanism of beta-1 and beta-2 receptors.